Appreciate you taking the time today to spend with us all day or part of the day. The staff has really done an excellent job, and I really congratulate Hector on setting this up. We wanted to do a live one and it just didn't work, and this virtual one is we're really excited about what can come out of today. So it's a good opportunity to learn about ACEs, adverse childhood experiences, and all the collaboration and coordination we're working throughout the county. And with that, I want to welcome you again, and I'll turn this back over to Hector. Hector, it's all yours.
Thank you so much, Roland. Thank you so much, folks, for coming today. My name is Hector Gutierrez. I am the Strategic Initiatives Special Projects Director for First 5 Kern. I have led our systems change work here for a little bit over 2 years, and was one of the ACEs co-leads to really support and move this work forward across Kern County. Today, I'll do a couple of housekeeping rules before we get started, just to get us acclimated before we kind of go through the agenda. Today, really, make sure the first session is a Zoom webinar. This session is being recorded, and so a number of you will be able to use the chat feature and really engage through the Q&A feature. Very different than Zoom workshops. And so, throughout the day, there's a number of different links that you'll be able to use to support the different engagement for the different things that will happen today. So in the morning, we'll have this session be done via Zoom webinar. Following that, we'll have concurrent workshops, and then think about additional workshops in the afternoon, and then a closing plenary session using Zoom webinar again. Before I get started, I want to thank our sponsors, Bakersfield American Indian Health Project as our ACEs champion sponsor, Kaiser Permanente as our presenting sponsor, then Anthem Blue Cross and Kern Family Healthcare as our gold sponsors, really supporting different workshops and investments to really make this conference happen. Today, we have a jam-packed agenda with you all to really support your understanding of what toxic stress is and how can we really work together to really catalyze and move this work together, not only here in Kern County, but across our region in the San Joaquin Valley, and then statewide with our partners who are also invested in this work to really support change for the generation to come. And so what the agenda looks like today is we'll have the welcome and acknowledgements from our partners, Bakersfield American Indian Health Projects. We'll have 2 keynote speakers, Senator Melissa Hurtado and Assemblymember Rudy Salas. From there, we'll shift over to a morning plenary session to talk about the state of Kern County systems and the post-pandemic recovery. From there, we'll have workshops, 4 simultaneous workshops that presenters will be able to choose from. Separate links for each of those that should have been emailed to you in a number of different ways. Then we'll go into lunch. There's also an exhibitor live Q&A if folks want to connect with some of the organizations that are on there live. We'll then have a concurrent afternoon workshops. And then, like I said, we'll have a break, and then we'll close with our afternoon sessions and a call to action to really support the health and well-being of our communities here in Kern County. Conference logistics. So like I said, morning webinar is via Zoom webinar. So the Q&A feature is available to you all. The chat feature is available as well. We will be having a number of speakers speak. So if you have questions, please feel free to use that Q&A feature or put it in the chat. If you put in the Q&A, we'll be able to respond. And questions that we're not able to respond to, we can answer at a different time following kind of closing of the program in 2 weeks when we send out kind of the videos and recordings of all the sessions that we'll have today. So without further ado, I want to pass it over to our Bakersfield American Indian Health Project folks that will do a land acknowledgement and welcome to get us started for today. Angel and your team, take it away. You're muted, Angel.
Is this muted?
There it is. Sorry about that. Thank you, Hector. My name is Angel Galvez. I'm the Chief Executive Officer with the Bakersfield American Indian Health Project. We're very delighted to partner with Kern County for this inaugural ACEs conference. It's a true treat for us to be able to offer an opportunity to read our land acknowledgement for Kern County and also to perform a smudge ceremony to bless the conference. I want to just very quickly introduce our team from left to right. We have Mr. John Delgado. He's our grants project program director. We also have the director of behavioral health, Ms. Evelyn Eterno. She's a licensed clinical social worker. Ms. Jackie, she is our chairwoman of the board of directors for the Bakersfield American Indian Health Project. I also have to my right, Ms. Donna Cubitt. She's our substance use disorder counselor, and she's also our cultural coordinator who works closely with our behavioral health department. I'm gonna just very quickly introduce our chairwoman. She's also the chairwoman of the Elder Council for her tribe. Ms. Jackie is a member of the Tejon Indian tribe, and we're very honored to have her talents as part of the organization. And it is our pleasure to introduce her. And at this point, I'm going to turn it over to her, and we're going to simultaneously do the smudging and the blessing, as well as read the land acknowledgement. Thank you.
Good morning. It's an honor to be here. Land acknowledgement in honor of Kern County Indigenous peoples, pueblos, rancherias, and tribal lands. To the original people native to this land, the area known as Kern County today is the homeland of several American Indian tribes, including the federally recognized Tejon Indian tribe comprised of Kitanamak, Yokut, Chumash, and Paiute peoples. The Tubatalabo comprised of Tulami, Tubatalabo, and Palagawan peoples, the Western Mono peoples, Kauai Sioux peoples, and Shalom peoples. May we acknowledge and honor our Indigenous people who came before us and still walk beside us today on these ancestral lands by choosing to gather today in the active practice of acknowledgement and appreciation for Kern County's Indigenous people's history, contributions, and lives. Thank you.
Oh. So at this point, we'll just give a few minutes of silence. What you are witnessing here in our other screen is a smudging ceremony, which we offer to all of you. We ask that the Creator bless this conference and that this conference be something that we all learn from, that we all take something from it, and that we use it to bring wellness to the community, to bring wellness to those who have suffered through traumas.
All the directions, all the statements of life. Blessings upon everyone that's here. Creator, make sure that this work goes in a good way and everyone can learn.
Thank you again, Hector. We appreciate you inviting us to do this, and we're honored again to really be part of this. We'll turn it back to you, sir. Thanks.
Thank you.
Thank you so much, Angel, for your dedication to this work and to your team for blessing us today and for reading those land acknowledgements. We look forward to working with you as continued partners to really support and engage, the communities that you work with and the communities that we work with to really support the health and well-being of the families that we're all striving to really support day in and day out. So one of the things that we want to do today is give some space to our keynote speaker, Senator Melissa Hurtado. State Senator Melissa Hurtado is the youngest woman ever elected to the California State Senate. Her Senate district in California's Great Central Valley is home to some of the richest and most fertile farmland in the world, one of the top oil-producing counties in the United States, and resilient working class families who power the valley economy. Senator Hurtado is the first from her family to graduate from college. She attended Sacramento State University, where she received her degree in political science. Prior to becoming the youngest woman ever elected to the California State Senate, In 2018, Senator Hurtado served as a Sanger City council person. In the legislature, Senator Hurtado is known as a thoughtful policymaker who works across party lines to improve the quality of life for residents and to ensure rural voices are heard at all levels of government. She focuses on rural community issues that often go unheard in the state capital: access to clean air and water, food insecurity, inequities in environmental policies, agriculture, and access to healthcare in rural communities. She was instrumental in sponsoring and moving forward SB 428, which she'll talk about today. In 2020, Senator Hurtado was honored to be an appointee by the National Biden Latino Leadership Committee, one of only 2 California Latinas on the committee. In 2021, she was selected to serve as a subcommittee co-chair on the Council of State Governments, and in 2021-22, Healthy States National Task Force. Without further ado, I'd like to introduce Senator Melissa Hurtado. Thank you for your time.
Thank you. Good morning. And thank you, Hector, for the wonderful introduction. I'd like to start by thanking Kern County First Five for inviting me here today, and as well as to the sponsors for making it all happen. As you discuss the impacts of childhood trauma has on our later health and what we here in California are doing to mitigate some of these effects. Last year, my Senate Bill 428, the ACEs Equity Act, was signed into law by Governor Newsom. The ACEs Equity Act has helped to ensure children, regardless of their insurance coverage, will receive vital screenings for adverse childhood experiences. Adverse childhood experiences, or ACEs as we know them, are traumatic events that occur during childhood from the ages of 0 to 17. They have long-lasting effects on health, well-being, and opportunity. The CDC identifies ACEs as physical, emotional, and sexual abuse, as well as physical and emotional neglect and household dysfunction. Together, these traumatic events occurring in childhood impact children throughout growth and into their adulthood. It's estimated that 1 out of 8 adults has had 4 or more adverse childhood experiences in the United States. This is relevant because a person with 4 or more ACEs is 2.4 times more likely to have a stroke, 1.9 times more likely to have cancer, 12 times more likely to attempt suicide, and 7 times more likely to be an alcoholic. When the COVID-19 pandemic first began, I believe many of us as adults saw our anxiety and our stress increase drastically. The devastating impacts of COVID-19 were felt throughout our population. And on top of the health impacts of the virus itself, family stress and adversity related to the pandemic is believed to have greatly impacted the health of our children and increased the number of ACEs they experienced. The uncertainty of the situation and what we could do to protect ourselves and our families increased the stress many experienced already. Despite parents' best efforts, many children noticed this uncertainty and the additional stress their parents were experiencing. As we saw throughout the COVID-19 pandemic, children went without regular interaction and play. Many were out of school or daycare or attended inconsistently. The isolation children experienced as schools and aftercare programs were closed made it harder for children to access services. It also created new stressors children experience, ones that they really hadn't experienced before. Also concerning are reports from child welfare systems who saw a reduction in child maltreatment rates, but an increase in child abuse injuries. This is something we will be coping with and trying to find ways to heal for quite a while. There were also a rise in reports of domestic violence. Many researchers believe that the stay-at-home orders and closure of community supports led to a decrease in mandated reporting, as well as support systems for individuals with substance abuse issues. This interruption may have led to unsafe parenting behaviors in the home, which put many children in unsafe living environments. The pandemic also brought with it loss of wages. Families already facing financial hardships face an increasing number of challenges to provide for the basic needs for their children and their family. This is why many experts are regarding the COVID-19 pandemic as a traumatic stressor itself, something that we may have seen cause harm to children and into the future. This could lead to a whole generation of children who experience a collective adverse childhood experience, which is why providing coverage of these screenings is so important, not just to me, but to our community and our state as a whole. It was important much before the pandemic as well. I spent a lot of time talking with families across the Central Valley who were navigating many of our healthcare systems and finding it hard to get much needed medical care. Children in marginalized communities are more likely to experience ACEs. And as we saw throughout the pandemic, our low-income, vulnerable communities suffer higher fatalities, higher infection rates, and were most likely to become or already be unemployed. All of this also impacted their ability to receive care. Prior to the passage of Senate Bill 428, only providers who were trained in seeing patients on Medi-Cal would be reimbursed to provide these vital screenings. Families with private insurance were not receiving consistent ACEs screenings, which means that many children were sliding through the cracks at an already vulnerable time. People should not be denied vital screenings because they do not have the right insurance or any insurance. I'm proud that our state and organizations like yours are taking such bold steps forward in continuing the care that's provided to our children, especially now that we know how interconnected our childhood experiences are to our behaviors and health and as adults. We know that childcare is education, and that the first few years of a child's life are the most critical for their development, something that will affect them in the years ahead. Considering things like childhood experiences as we focus on our care needs for children will help make a great difference in how these children grow up and may prevent future health problems. The programs that connect families to healthcare, supportive services, education, provide another step in ensuring that young children will be able to enter school healthy and ready to learn. And now with the addition of ACEs screenings and early interventions, we can help children develop the skills they need to become productive, happy, and healthy adults. I know these past 2 years have been very, very difficult. And I'm hopeful that we are on the upswing and should slowly see our lives get back to a state of normal. It is my hope as we move back towards normal that policies that catch up and provide services to the many children and youth who have fallen through the cracks during the pandemic become priorities again. As chairwoman of the Human Services Committee, mental health has been a priority for me. And when the issue was brought in front of me by healthcare professionals providing these screenings, I knew that I had to do this and it was the right thing to do. Having adequate access to screenings and services, especially finding ways to make it easier for families to use existing programs, has been something I've worked to address since I was elected. I've heard too many stories from people unable to receive the help they desperately need. I've heard from way too many parents and the stories of losing children due to their mental health. I'm grateful for all of your hard work and the efforts you're all making within your respective organizations to making accessing such services and screenings easy on California families. It takes a partnership and really a team of everyone working together to assist families and get them the help and resources they need. As I looked over the many organizations that would be in attendance today, I know that you're all leading these efforts from the ground and providing the best care, support, and services that you can for children and families across California. Thank you again for inviting me to speak with you today. And thank you for your hard work and dedication to California's children and families.
Thank you so much, Senator. We appreciate your words and your dedication to really supporting what this work looks like. We have a few more minutes. Folks, if there are questions that you have for Senator Melissa Hurtado, please put them in the Q&A. one question, that we got from some of our participants, Senator Hurtado, was, what's next, right? We passed this law. How do we operationalize it and really support to mitigate that toxic stress that we see in our communities day in, day out? How, what's your vision as this legislation has come into fruition? What happens next as we move forward?
Well, I think that we have to really modernize healthcare in the state of California. We have to make sure that we have an adequate, amount of healthcare professionals and providers within the state, but especially in communities that are underserved, because that's where we see the a shortage of providers and that's going to increase. And so that's got to be key in moving forward and helping this become more successful. We also have to look at other issues that also contribute to well-being. And one of the things that I like to kind of also focus on as part of mental well-being is nutrition security, because we talk about food security as being, component to well-being, but nutrition security is equally important. And there's been a lot of new research that is being done in terms of how, I believe that the word is microbiomes in the gut really impact mental health, and how that's such a huge and critical component as a child is developing, and those, what a child eats also contributes to mental well-being and in the future of that individual as well. So I think there's got to be a focus on that, focus on making sure that we modernize our healthcare, that we have an adequate amount of providers, that we are adequately and training providers to be able to do the screening. I think will continue to be something that we need to be on the lookout for.
Great, thank you so much. We have a couple of questions from folks. I think one of the big questions is, how do we make, a lot of the training for ACEs has been for clinical providers, but how do we think about sharing this information with community? What steps can we take at the local level to really engage our families, given sometimes the ACEs screening could be triggering or can kind of bring things up and re-traumatize some of our communities. What are your thoughts on some of those resources that folks on the ground doing this work can support for community?
Well, look, I think that every community is different. And I think that the stakeholders on the ground know their community best. I think that you all have the solutions and the ideas of how to make this best happen. Obviously, I think building as many partnerships as possible is important. I also believe that education, campaign education is equally important, but it's got to be in multiple languages so that we're reaching out, across all communities, and maybe even working with schools and partnering up to whatever extent that we can with schools. I think is just going to be a critical component of all of this.
Great. I know you mentioned that mental health is a big issue that you're working to support in communities, especially as we've seen the isolation and toll that the pandemic has taken on families. What are some of the future things that you're looking to work with our community partners to really support this work around mental health? Yeah,
look, even prior to the ACEs work that I've been doing, I focused on trying to put together a plan that would allow suicide youth prevention plans at the county levels. I know it's something that more county, the bill didn't get through SB 331. It failed in the assembly, but I know that counties were working towards addressing, putting plans together for youth, because I think that when it comes to policy at times, or many times, sadly, we often leave children and youth out of a lot of key policy decisions. And so, I thought that was an important piece to mental well-being and mental health, is including our youth and having a plan. And while the bill didn't get through, I know the counties are adopting that. I think that's going to be an important piece to ACEs, and the work that is needed to do is also partner up with the county at the county level and see what additional work could be done in working and partnering with them. And I also think that looking at other things that impact mental health, and as I mentioned earlier, nutrition security, making sure that struggling families are and their children have access to good nutritious food, because good nutritious food has a direct impact in an individual or in a children's mental well-being and its own health. And so we got to make sure that we're not just providing food security, but that we're providing nutrition security as well. So I think that the work that we have already done in the legislature to expand food year round to children at schools, I think that's a great start, but we got to talk about good nutritious food, healthy food that's going to provide a just good mental well-being at school and beyond.
Perfect. Another question we have from the audience is, how can we begin to think about ACEs and the intersection that happens between counties to really support, especially our farm working communities, the communities that represent the Central Valley, given that they're mobile? How can we begin to, work together to really address those needs for those working communities that we're working with and that you represent in your district?
Well, I think it starts with having a conversation and seeing where there is common ground. Obviously, there's got to be a start somewhere, and I think that we all have expectations, right, of where we want to be. And I know that in the policy work that I do, sometimes I want I want something resolved like right now, and I want to be able to do that through policy. Sometimes I also recognize that that getting to that it's not necessarily feasible at the moment, but sometimes it means maybe taking a smaller win is just as important in the goal of achieving what I ultimately want to achieve. And I think that in this case, in partnering with counties, I think it's important to think big and have those discussions early on. But having the discussion and getting a small win is a win in itself, and working towards that big goal is what we want to continue to work towards, whatever it may be for each and every individual county or organization. But also just knowing that the smaller wins are also very important.
Great, thank you so much, Senator. One of the things that are, folks on the panel want to know, what's your why? Why do you do this work? Why are you such a fearless advocate for communities? And if you could share a little bit about why, you're so passionate about what you do and how you do it.
Yeah, absolutely. Look, I come from a small rural disadvantaged community. I know what poverty is like. I've lived through it, not just as a child, but as an adult as well. And I've been very fortunate to have, organizations that have provided me an opportunity that if they didn't, I wouldn't be where I am today. And so I think that in protecting our most vulnerable, we also have to protect them, but we have to provide opportunities. But if we don't protect them to begin with, then the opportunities just become significantly less. And so making sure that that our children are healthy, it's really where it all begins, because that's ultimately what's going to lead them to the opportunities. And so, mental well-being, especially in our youth, is super important to me, because I've also here in the community that I was raised in, I've seen firsthand, children and the impact that different, traumatic events in their life, what it leads to, and it has led to suicide. It has led to substance abuse later on in their adult life, and it's not just seeing it in youth in my community; it's also loved ones too. So I know that the impact can be devastating down the road for individuals, and once they reach adult life. And I always say that we got to get them young, and if we don't get them young, we almost lose them forever. So I think this is just such a huge piece, and there's still a lot more work to do, because I don't think it's the only piece, but it's a huge piece in making sure that all children are provided an opportunity at a very young age to accomplish their full potential in adult life. But if we don't invest and address the issues at a young age, then we could potentially lose them forever.
Great. Thank you so much for your dedication, commitment to really supporting what this work looks like. Any closing reflections that you want to just share with the audience? And I know some folks are interested in, how do I connect with Senator Hurtado's office? Wanted to connect with you on some of these issues. Any final reflections before we transition on to the next speaker?
Yeah, I just want to say that the door is always open with us, and that please reach out. If we don't hear from you, then we don't really know what's going on. And so the office is the office of the people. It's not my office. I'm just there temporarily, and I think that because it is your office, reach out to it, drive the issues that are important to you, educate me, because I don't know it all. And so our door is always open, because it's your office. So please reach out.
Thank you so much, Senator Hurtado. We appreciate your time, dedication. I know you have another speaking engagement that you're going to, so appreciate the time that you've given us today to really speak to the work that you've done and the work that you'll continue to do to really support children and families across the Valley. Appreciate your time and dedication.
Well, thank you, everybody.
Have a good one. Thank you so much. And in the chat, we'll put in how to contact Senator Hurtado's office if you folks are interested in really connecting. There's also the website, which Michelle has put into the chat, that folks are interested in doing. So one of the things that, we will also want to introduce our second keynote speaker. First elected in 2022, Assemblymember Rudy Salas represents the 32nd Assembly District, which is comprised of parts of City of Bakersfield, City of Arvin, Avenal, Corcoran, Delano, Hanford, Lemoore, McFarland, Shafter, Wasco, and communities of Bottom Widow, Home Garden, Kettleman City, Lamont, Lost Hills, Stratford, and Weepatch. Since his arrival in Sacramento, Assemblymember Salas has stood by his commitment to take a stand for Central Valley families and the interest in the region. As the state struggled through COVID-19 pandemic, Assemblymember Salas was instrumental in getting hundreds of thousands of protective equipment to frontline workers, not only those working in hospitals, but also in agricultural fields. As California recovers from the economic toll of the pandemic, Assemblymember Salas gave a boost to the region by securing $50 million in dedicated investments in Central Valley projects that will expand local nursing programs and construction and emergency response center, cooling center, and clean water, and a new building for the Bakersfield College Delano campus. Salas has been a steadfast voice for the Valley in the capital, prioritizing the issues of public safety, clean drinking water, small business success, improving air quality and healthcare, and a number of other issues that include workforce development and expanding the valley's educational opportunities for families. In 2021-22 state budget, he was able to secure $2 million for an emergency response center in Abinah, and also secured $5.7 million for construction of Corcoran's new police headquarters, which is now finished. In response to the drought, Assemblymember Salas has also advocated for the allocation of more than $1.38 billion for clean drinking water investments and infrastructures to rural communities. In 2019, he also secured more than $12.5 million specifically for Central Valley's safe drinking water projects. With healthcare being a persistent issue in the Central Valley, Salas has been a leader on the issue as we address Valley Fever, delivering more than $10 million in investments for research and outreach. He has authored legislation that makes reporting and Valley Fever resources more reliable and available for workers, and has saved Kern Medical from closing its doors. Assemblymember Salas continues to stand up for Central Valley in Sacramento. It is an authoritative legislation to reform the Employment Development Department, protecting veterans from discrimination and increasing the pipeline safety and more. Without further ado, I'd like to welcome Assemblymember Rudy Salas to give our keynote address. Assemblymember Salas, take it away.
All right, good morning, everyone. Thank you for having me, appreciate it. And it's just always a pleasure to be with you guys. I know there's a lot of folks on the call that are from the Valley and from the entire region from across the state. So really appreciate the time and appreciate you guys inviting me on. Let me just say that first, I love everything that First Five does, everything that you guys do to focus on children. And, I know we're talking about ACEs and we're talking about everything, all of the needs in our community. And I'll just say, right now, especially coming out after the pandemic, I know, Hector, you were talking about some of the things during the pandemic, but one of the things that we began to talk a lot about in the beginning of the pandemic and then throughout the pandemic was actually even the mental health of our children and what they were going through. And we know that some students were struggling, especially with the online and not having all of the social interactions with their peers. And we know that others were actually thriving a little bit more. So, but how do we make sure that nobody's falling through the cracks, and how are we making sure that we're still providing for all of our students? And so whether they're, 0 to 5 or all the way to our high school students, that we were still being there for them. So, my priority as a state legislator is always to ensure that our children are being, cared for and protected, from harm. So I appreciate the work that you guys do. Earlier this year, I introduced AB 2602 in the state assembly, which actually pushes for prevention. We are trying to help also on the funding front. I know you listed a lot of the funding that we've been able to get into the district. I know last year we were very successful in the state budget. We got over $50 million just in direct funding for some of the things that you listed, right? New building for Bakersfield College, doubling the nursing graduates at BC, and increasing the funding for the nursing program over at Cal State Bakersfield. And then I know we've also pushed a lot in the state budget to actually fund mental health services for our students. And so we've actually put millions of dollars there in the state, and we're looking at partnering not only with organizations like First Five, but even working through our schools where we can start developing more mental health centers. And I know we have a couple of schools here in Kern that have those, but trying to figure out how do we expand those and expand those services for our residents, for our community, and for our students. I know I was approached by First Five earlier this year too, to help with the Have a Heart, Be a Star, Help Our Kids, the Kids Plate program that supports our child abuse prevention services. So we introduced legislation to actually help do that. You guys have been great in helping me with Assembly Bill 58. We know that one of the leading problems that we have with children is actually youth suicide. And so First Five has been great at helping with that. And that bill we introduced last year is moving its way through the process. It's passed the Assembly and now it's on to the Senate. So thank you guys for your help for that. And then more than anything, we just want to say, you guys at First Five Kern, you guys engage with so many of our community partners, and you continue to push forward so that we're addressing all of the concerns for children. How do we make them healthy? It's not just, making sure they get, their medical appointments done, but even looking at it through mental health and looking through it through a huge variety of lenses, so that we're looking at it holistically. Is it food? Do they have enough food? Is their mental health actually being cared for? Is it, do we have facilities to even host these kids? It's very holistic. And so I appreciate that approach that you guys take at First Five, because I think it's just vitally important that we do this and that we continue to help in every which way that we can. So more than anything, I'm just here to say thank you guys. You guys are doing the hard work. You guys are on the ground, living this every single day. And so just appreciate the hard work that you guys do, and just know that you guys have allies up here in the state capitol that want to help you. But sometimes we don't always know exactly how to help, besides trying to bring additional funding. So if there's things, specifically that need to be addressed that are not being addressed, or you're seeing children falling through the cracks in a certain way, then that would be helpful to us up here, especially as we start working through the budget process, or whether it's specific legislation. We're more than happy to help, but just don't feel afraid to reach out, because a lot of groups aren't afraid to reach out. And so, in this case, it's always the squeaky wheel gets the oil. So make sure that you're reaching out to us and letting us know not only what's going on, but how we can help out additionally. And so we want to do that, and we want to be there for you. And we just appreciate all the work that you guys do.
Great. Thank you so much, Assemblymember Rudy Salas. A couple of questions for you. I know you've done a lot of work on the Early Childhood Committee that you sit on. Can you speak a little bit about what some of those priorities have been for children, and how that ties into some of the work around ACEs and that Kern County could be working on to really support children and families?
Yeah, definitely. So I'm chair of the Select Committee on Early Childhood Development. And earlier this year, we actually had a hearing with one of our budget subcommittees with Dr. Arambula. And we're just looking at not only just funding and how is funding actually being dedicated towards children, but even, additionally, how are we doing things to identify children that need to be identified early on for things like autism, for disabilities? Are they getting the services that they need? And are we identifying that early? We've spoken to parents from throughout the state that indicate that, those initial screenings actually take a lot longer than they think they need to. And all the studies show us that the earlier we identify some of these issues and start helping these students, that it has a lifelong impact. And so that's what we've been focusing on, is like, where are those things where we can help and actually push, so that things like screenings and things like resources continue to be provided, especially early on, as opposed to later. So that's one of the aspects that we're looking at in that committee. But the committee has got a broad range, and so we've been looking at also using the committee to push funding for additional things. Obviously mental health is up there on the list as well. And so as we continue to move through the budget process, we'll continue to keep pushing on those issues also.
Perfect. Thank you so much. Another question that came in from the audience is, there's a lot of work that our family resource centers do here in Kern County to really support communities, given the large geography that Kern County presides in the state. What are some of the things that your office or other things that are happening in Sacramento to really support family resource centers and to get them funded to support, those connections that help families thrive when they're in need?
Yeah, no, I love our family resource centers. You guys are definitely on the ground and connecting directly with the families and the students. I know my office has worked with a number of family resource centers, and whether it's getting a backpack, a coat, or even some food boxes delivered to some of the families that are definitely need it, we're there for them. I will tell you guys that right now, in terms of the budget and actually funding and the resources, we work a lot with the school districts. And since I've been elected for the last 10 years, we've always increased the school budget. And we're going to increase it again this year. It's not guaranteed until we pass it, but I feel pretty good about us actually increasing it this year. So we will have the most per pupil spending that we've ever had in the state of California. And that's going to continue to happen. So as those resources get to open up to our schools and to our local school boards, and definitely there's going to be more resources around it. I'm hoping those resources actually make their way to the family resource centers, because we know that they're actually impacting the students' well-being and actually the health of the entire family.
Great, thank you. Definitely looking to support those local advocates and case managers that are really supporting our work. Another question that we have from our participants is, Help Me Grow here in Kern County is a program to help screen for developmental delays in small children. And so I think one of the challenges some of the folks who do developmental screens is that once a child is screened and, there's some of those delays, that there's a lack of resources to connect those families. How is your office really addressing, some of the developmental delays or issues that are impacting children here in Kern County and in the area that you serve?
Yeah, no, I'd actually love to learn more about how we're actually doing that. That's what we're trying to do with the select committee. That's what we've been doing with the budget subcommittees, is trying to make sure that those resources are out there. I always say that you guys are the experts. You guys are the people on the ground. And if there's something that the state is not doing, that's where we interject and try to make sure that we're connecting those resources to everybody here locally. I love our area. I love our region, but I want to make sure that those resources are being provided. So what I would say is make sure that you reach out to us, reach out to my team, whether it's in Bakersfield or whether it's in Hanford or in the Capitol. We can make sure that we're connecting folks. And if you see that there's a huge disconnect, if they're not getting connected with the Department of Education, or they're not getting connected with CDPH or any of the departments, and that's something where we can actually go in and make sure that we're fixing and creating those bridges that need to be created so that those resources are there. In my opinion, I don't think that there's any reason why there shouldn't be resources, given what we've been doing in the state budget over the last 10 years in terms of actually increasing a lot of the department's funding. And so we want to make sure that those fundings are actually targeting things that are helping our children and helping our kids throughout the state. So love to partner with anybody. If that's not happening now, let's do that.
Great, thank you so much. Definitely, your office has always been accessible to us, and great opportunity to really advocate for children and families here in Kern County. I think one of the questions that we asked Senator Melissa Hurtado was, what's her why? Why do you do this work? Why are you so passionate about supporting and representing families in the Valley? Can you speak a little bit about why you do this work and the work that you're championing in Sacramento?
Yeah, I was born and raised here in the Valley, right? This is home. Family lives here, friends, neighbors, people I've grown up with. My why is really trying to make a difference for all of our families and make life a little bit easier. So whether that's helping in childcare, healthcare, their jobs, job training, I feel like my job is to help make a difference in everybody's lives. And so if you look at my career over the last 12 years, you'll see that everything that we do is trying to do that. I tell people everyone can have an impact, right? You can have an impact with the job that you're doing. You can have an impact by dedicating a couple of hours on a Saturday to make a difference. So I tell people that when we went and painted the homes of veterans and seniors, in 4 hours that you would have been at home, we could actually help make a difference for this family, right? Or I tell the high school students all the time too. I was like, hey, you don't like seeing the graffiti in your neighborhood? Let's get together on a Saturday, half a day, we'll knock it all out, and we'll help make that difference. So my why is just, we can all make a difference. We can all do something. And so I just, I'm fortunate enough to be elected and to be blessed that the voters have put me in to actually help work on my why to make a difference for everyone.
Great, thank you so much, Assemblymember Salas. And final question, as you look at ACES and all the work that's done in Sacramento to really operationalize that, what's your vision for ACES as we, deploy resources and move this work forward here in Kern County over the next few years?
Yeah, I think I want ACES to be impactful, impactful for families, impactful for students. I wanted to make a difference in people's lives. And I think that's what this funding is put there for. I know when we were talking about it as the bill was moving forward and making sure that the resources were there through the budget process, is we wanted to make sure that we're providing for students and providing for kids. We know that the pandemic is, we focused a little bit on the mental health during the pandemic for kids as well, but making sure that all the options are there for our students and even for our littlest ones, because without a strong foundation, we know that, it's going to be a lot harder for them in life. And so we want to build that strong foundation for 0 to 5 children. And so, that's why you've also seen the state expand on things like TK, right, for kids. And so I want ACEs to be impactful, and I want to make sure that we're doing that and that it's being targeted. If there's things that we still need to work on at the state level, you have advocates here that want to help you, that want to fight for you. But sometimes we don't always know like the exact way how to do that. And if there's a specific policy, if there's a specific resource that can be targeted, then we want to do that. And so I would just encourage you guys to continue to keep reaching out to us and to other offices, whether it's other assembly members, because the bigger the coalition we have, the easier it is for us to kind of push and advocate for things, especially as we move through our budget process and we move through the legislative process as well.
Great. Thank you so much, Assemblymember Salas. Appreciate your time and dedication to the Valley and all the hard work that you've been doing to really support, our families across our geography. So any final reflections or closing remarks that you'd like to say before we transition on to the next part of the agenda?
Yeah, no, I just want to say I love the work that you guys do, and just know that you have an ally here and that we want to be helpful and just continue to keep having an impact. I tell people we have that power every single day in our lives. So you reaching out to one more family, you reaching out to help that last student or staying after just a little bit longer, like it all makes a difference. And I just want to say thank you guys for doing that, because we wouldn't be in this work if we didn't have the heart and the passion to make a difference. And I just truly appreciate your guys' hard work.
Great. Thank you so much, Assemblymember Salas. We appreciate your time and dedication, and we look forward to working with you as you continue to fight and advance policies that support children and families across our Kern County.
All right. Thank you, guys. Appreciate you having me on.